the whole budget of all the 47 counties for the health is around 120 billion. You will still find the Ministry of Health and MOH retaining a whole whooping 185 billion just to do the coordination work that they do. Of course, you can't challenge it because, you know, when you talk about the revenue sharing, the formula that is formulated, if the CRA, they sit in the same boardrooms with them. If it is the Minister of Treasury, they're in the same boardroom with the Minister of Health. As the Council of Governors, we are out there as those governors. Yeah? And those things will happen. And therefore, it is important for Kenyans to know, even as we discuss that problem, health is devolved, we are not being able to meet our obligation, it is nothing else but just resources to be able to carry out these duties. But this is something that we are hoping that it is going to improve with time, is that all the 47 counties have 95% of the health personnel that we are discussing at the moment, including the doctors, the clinic officers, and even the lab technicians that are currently on strike. Those 95% of those health workers, none of them has a contract with anybody in the whole of Kenya. Every doctor has a contract with a specific county. If it is the doctors in Nairobi, they are not answerable to the governor of Rakanithi. However, mysteriously, and I don't know how that happened, they are under one umbrella of a union that purports to control everything in the 47 counties. It is amazing. I tend to think, although I do not want to go along that route, there is more than that meets the eye in that strike. Especially now that you see this succession move from the doctors to the clinic officers to the clinicians, to the lab technicians. And next could be the support staff, and probably the nurses are doing it in a different style. So we need to dig deeper. I know what is eating. We know what is eating what, because I don't believe it has anything to do with those things that are being talked about. There's something else beyond. I don't want to say it's politics, because that would be very bad politics. The CBA was signed in 2017, and those fellas were very clever. It was signed in 2017, just before elections. I will not stand here on behalf of Council of Governors and say it was signed under duress, so I didn't say it. And some of those terms that have been put there are the ones I'm talking about. A CBA that talks about interns being recognized by the union, yet they're not employees of the either OMOH or Council or the county governments, then there's a problem there with our CBA. However, I am reporting with a lot of confidence that most of the counties are at 95% in terms of payment of arrears of some of those issues raised in the CBA. In fact, last time we took an audit, some of the counties had actually overpaid. And therefore, we need an interrogation of that CBA. We need to go through it with a tooth comb to ensure that we are talking about CBA that may be warranting a strike, because different counties are different levels. That is why I would really appreciate if the strikes were divided in terms of counties in this country. I'm sure if it was done per county, there may be less than 10 counties where the doctors will be on strike. And even those will be at very advanced levels in ensuring that those terms are met.
We started mapping out our families, our individuals and communities, linking them to the facilities and finding out what are the issues. It's an ongoing project and is very, very sustainable as long as community health services level 1 is functional, is sustainable and replicable.
This award goes to all the 8 treatment sites for Changamwe, for TB, and my implementing partners. AMREF, Reach Out Center, NACADA, and Bomo Hospital, AMREF, and the Department of Health, Mombasa County.
Please, I'm telling you like your peers, we have received your issues, and I know the governor is here. He will attest. And we acknowledge, yes, there are issues, but we can't sort them when we are raising banners in the streets. When the government has offered to release money to sort out some of these issues, meanwhile, we continue being on the table to discuss. And again, the court has asked you, call off the strike and allow diplomacy to take place. Why do we have to go back to the streets? HRH is an agenda that we cannot leave behind. Alongside all the others, digitization, health financing, commodities, HRH is top on the list. And this is the time to have this very discussion about it. So for me, my door is open, as always. Any ideas that you have, we have the list, and we know what you're asking for. We know what is doable, and you know equally what is doable. So if we have extended goodwill, and we have actually started actioning on some of the demands that have been placed, why do you have to leave the patients to die? So let us put our heads together. Let us reason together. And let us make this country a better place.
Well, when you are discussing the issues of healthcare, consider my nearly 64,000 inmates, that they also need and have a right to provision of basic minimum standards of healthcare. Come and build our capacities. In the 135 facilities, less than half contain level 2 hospitals. Actually, we don't have. We only have healthcare centers that at the very most have only first aid facilities. Why is that? Because we have budgetary constraints and because we need to incorporate that one government approach so that the Ministry of Health comes in and builds our capacity, helps us build the healthcare facilities in prisons. What is the effect of that gap? The effect of that gap is that we have a lot of inmates who die because we cannot provide them with quality healthcare. Come in, involve us. We don't have bureaucracy because in my department we have no sagas, we have no parastatals, so it's very easy to interact with us. Under me is the Commissioner General who heads the Kenya Prison Service and the Secretary Probation who heads the probation and aftercare. So it's very easy for us to interact and have a conversation where you can help us improve the healthcare of our inmates.